Compassion meditation for pain and discomfort. I would like to share a few things with you before we start today's meditation. When we focus our attention on physical pain or discomfort, as we do in this meditation, it is very common to experience these sensations more intensely. Therefore, it is crucial to understand that this increase in pain or discomfort is typically temporary. Moreover, when it does happen, it may be a good idea to divert the attention to another area of the body that is not hurting, for example. I always highly recommend treating the pain conditions with appropriate medications or treatments as prescribed by the healthcare professionals. Mindfulness meditation, while helpful in many cases, will likely not fully heal serious physical conditions. The purpose of this meditation is to bring at least some level of comfort and relief to any physical pain or discomfort you may be experiencing in the moment. Start by finding a comfortable position, either sitting or lying down. Allow your body to be as relaxed as it's possible for you right now. You can close your eyes if it's comfortable for you, or keep them open with a relaxed, soft gaze. Taking a few deeper breaths to anchor in the present moment, and then preferably returning to the normal rhythm of breathing. I invite you to shortly scan through the body, noticing the sensations in each part of the body and allowing the muscles to relax as much as possible. Starting from the head and the face, notice your face expression. Relax the forehead, the brow, the eyes and the space behind the eyes. As you breathe in and out, notice the sensations in your jaw, and if there's any tension, consider if it's possible to let the jaw relax too. If you are already noticing any discomfort or increased tension in your face or jaw, you can experiment in gently putting one or both hands on your cheeks, allowing the warmth from your hands to soothe the unpleasant sensations for a while. As mammals, we often respond very positively to the touch, and we can support ourselves with touch just as well as we can be supported by others. If you find this helpful, you can apply this kind of gentle touch or caress going forward to any part of the body that causes you discomfort. Let's move our attention down to the throat, to the neck, both front and back of the neck, then the shoulders. We typically carry a lot of tension in those areas, which may cause pain sensations. So I invite you to try a gentle self-massage of the neck and shoulder area if you find it helpful. Relaxing the shoulders as much as possible, noticing sensations in the arms, in the hands and fingers, moving down the back from the upper back, middle back, down to the lower back. Remembering to gently relax if possible, adjusting position if necessary for more comfort, and simply being with whatever is present. It is possible that there is no sensations in certain areas of the body, and that's okay too. We can still notice the lack of sensations, and simply imagine the areas relaxing in this mindfulness practice. Moving to the front of the body, noticing all the sensations in the chest, the upper and lower belly. Again, if this is comfortable for you, you can experiment with placing one or both hands on the heart or the belly area, or perhaps one hand on the heart and another on the belly, and allowing this gentle, warm touch soothe any tension or discomfort in these areas. Letting the breathing fully expand the chest and the belly with each breath. Sensing the rise and fall of the chest and the belly for a short moment. Moving down to the legs, from the upper legs and knees, down to the lower legs and feet. Relaxing what's possible to relax and noticing the sensations, whatever they are. Noticing how the feet or legs are placed on the surface you are sitting or lying on. Allowing yourself to be safely rooted by the force of gravity to the ground, through the legs and the feet touching the ground. Now taking a moment to feel the entire body as one big field of sensations. Perhaps in some places there were a bit unpleasant or painful sensations, and in other places they were more neutral or even pleasant. Notice these various parts as being all elements of your human experience in this moment. We will now move our attention to the area of your body where you are currently experiencing some discomfort or pain. As mentioned earlier, if the pain or sensations become too intense, you can always shift the focus to the breathing or the area of the body that is neutral or pleasant for you to focus on. So, if it's possible, I invite you to focus on the sensations in the painful area. What is the nature of these sensations? You can softly mentally name the sensations. For example, pinching, pulling, piercing, searing, twisting, burning. Use whatever labels come to mind, as there are no correct names for these sensations. Take your time feeling into the area of discomfort. Can you describe the sensation as having some kind of a texture, size, or color? It may be helpful to breathe into the area of discomfort, imagining that it provides some relief, as the fresh oxygen is distributed by the blood into the area. And breathing out, imagining that the air leaving the lungs carries the pain out of the body. Returning to noticing the sensations, mentally noting their nature, texture, size, or color. Now we will switch the attention to the pleasant or neutral area of the body. If you are experiencing many areas of discomfort, it may be a bit more challenging to find a neutral area, but in almost all cases it is certainly possible. Consider small or even tiny body parts like hands, feet, fingers, toes, ears, the lower lip. Whichever area you can locate that is neutral or pleasant will work very well for this practice. I invite you to focus on the sensations in that pleasant or neutral area. What is the nature of these sensations? As before, you can softly mentally name the sensations. Maybe you feel warmth, tingling, pulsing. Can you imagine these sensations having a texture, size, or color? Are the sensations changing as you pay closer attention to them? Allow yourself to rest in these more pleasant sensations in this part of the body for a while, relaxing the whole body and mind as you stay present. Let's return to the area of discomfort for a short moment. Again, if possible, try paying close attention to the sensations in that area. What is their nature now? Have they changed or do they seem to be the same? What would be their structure or texture, size or color now? As you breathe into the area of discomfort, can you notice the possibility of relaxing a bit around the pain? Stay with the area of pain, noticing any changes if they are happening, and remember to shift the attention to any neutral or pleasant area, or focus on breathing if sensations become too overwhelming. As you move back and forth from the area of discomfort to the neutral or pleasant area, notice any shift in sensations in these areas. Finally, staying with the sensations in the painful area, if it's possible for you, I invite you to again apply a gentle touch. If the body part is not accessible to your own touch, you can simply imagine someone caring, gently placing their hands on this area with the intention to bring you some relief. You can massage the muscles or just keep the hands placed softly on the skin, whatever works for you right now. And you can move back and forth from the area of discomfort to the neutral or pleasant area, noticing any shift in sensations, simply staying and allowing them as they are. You are not alone in experiencing the pain or discomfort. We all deserve the relief from pain. We deserve the compassionate touch and care from another human being. And you are taking the best care of yourself you possibly can in this moment, by being kind and compassionate and taking time to pause and relax as much as it's possible for you today. As we finish this practice, feel free to keep your hands placed gently on the area of discomfort while scanning again the rest of the body in its current state, relaxing the muscles if possible. Noticing the sensations in the feet, the legs, the belly and chest, the back, fingers and hands, arms and shoulders, the neck, returning all the way to the jaw, face, and head. Taking some deeper breaths again. Returning to the body. Now I invite you to slowly return to your surroundings, stretching the body and opening the eyes if they were closed. Allow yourself some time to return to your usual activities, and feel free to return to this meditation if you found it helpful in working with pain and discomfort.